Those who are trying to underestimate the threat of COVID-19, as Deputy Murphy just did, need to explain how there are hospitals in this city at the moment who are turning patients away because they've had COVID outbreaks. Whether they're COVID patients or they're non-COVID patients, and that's with infection rates at a relatively low level. If they rise, our hospitals will be overrun, and people who make irresponsible comments will have a lot to answer for. Now, in the insulting amount of time we're given to discuss the most important issue affecting this country, I'm just going to make one point to the Minister. If you want a COVID strategy that works, you treat with respect and dignity and support the health workers who are on the front line fighting COVID-19, which you are singularly failing to do. I won't go through the long list in detail, whether it's the contact tracers and testers who don't get sick pay, who are on temporary contracts, whether it's the nursing staff who've had their pay cut over recent years because of FEMPI and all the rest of it, the understaffing, the under-resourcing. But just let me speak out for one particular group: the student nurses and midwives, thousands of them who've been working on the front line, who you were forced back in March and April to accept were working and therefore should be paid, and then pull the rug on that payment and now have them working for nothing again while they're working on the front line. I held an online meeting last night with student nurses and midwives, and I'll just read you some of the comments in the short time I have available. They were furious with you, Minister, in saying that the 50 quid allowance they get for accommodation, which most of them, or many of them, don't get, by the way, and the miserable little travel allowance cover the fact that they're working for, well, I'll just go through it, or that you are protecting their education. They just laughed at that. They said, we are left on our own devices to do frontline work. Another, we're doing 12 and 13-hour shifts with no nurse beside you. Another, we're working in a red zone with COVID patients, covering for staff shortages and people who are sick. Student nurses are worried about their family members with underlying conditions. We had to give up our jobs, in order to do our placements. This wouldn't be tolerated if we were mostly men. How is it that paramedics, guards, and those who do military training and apprentices get paid while they're training, but we can't while we're actually working on the front line in hospitals? The €50 allowance, that wouldn't even cover the cost of our accommodation. It would barely cover the cost of a cardboard box. We need to have to pay for parking, and the parking charges for 1 week are more than we get. Some are paying 3,000 fees and not getting paid. Mature students are paying €7,500 and not getting paid. We fear about speaking out. We were warned not to speak to the media. Mental health nurses talking about the fact that their mental health is absolutely in bits because of the situation they're facing. We're doing multiple academic assignments while filling in for sick staff and understaffed hospitals. How are we supposed to even live or do our shopping? That's how you're treating. Pay the student nurses, end the exploitation, and treat healthcare workers with respect.